Hi, everyone. As Dr. Rowling had mentioned, there's a lot of material that we're going to be covering tonight. So we're going to jump right in, and hopefully we have more time for your questions that way. So tonight we're going to be talking about oral rinses. We want to know what's safe. We want to know what's effective. And just housekeeping, Dr. Rowling has already mentioned that I'm affiliated with ioTech International. We make oral care products. Why are we even talking about rinsing at all? Well, uh, when we've gone through dental school or dental hygiene school, we've been drilled with the mantra brush and floss, brush and floss, brush and floss. And we are to repeat that mantra to our patients to make sure that they also brush and floss. But there's good reason not to neglect rinsing. At-home rinsing, as it turns out, is extremely effective in helping to reduce gingivitis and plaque buildup. So there were three important studies that were done comparing at-home brushing and rinsing to at-home brushing and flossing. And in the first study, which was a 6-month long study, randomized, controlled, the evaluators were blinded, uh, and there were over 300 patients in that study. They found that at home brushing and flossing achieved a 2.1% plaque reduction rate, where brushing and rinsing at home achieved a 37.5% plaque reduction rate, which was 18 times better plaque reduction than was brushing and flossing. So, in the second study, which also was 6 months, also 300 patients, also evaluators were blinded, controlled study, they also found that with brushing and rinsing, they got a 6 time better plaque reduction with brushing and rinsing than they did with brushing and flossing. And in the third study, which had 160 patients, here they were looking at the bleeding index, the modified gingival index, and also the plaque index. And for those indices, they found again that brushing and flossing was not anywhere nearly as effective as was brushing and rinsing. And by the way, it didn't make any difference which type of rinse they used in the study. Each was more effective than brushing and flossing. So let's look more carefully at chlorhexidine gluconate as a rinse. You're all familiar with chlorhexidine gluconate. You formed, I'm sure, by this point, many strong opinions about chlorhexidine gluconate. So let's just review some of the pros and cons. So chlorhexidine gluconate is very active against gram-negative and gram-positive bacteria. It's also active against aerobic and anaerobic bacteria. Uh, it's been awarded the ADA's seal of acceptance, and because it's been used so frequently and for so long in perio care, it's considered to be a gold standard chemotherapeutic agent. So, even though chlorhexidine gluconate is an excellent antibacterial agent, doesn't mean that it's a good antiviral agent. And in fact, in a study that was done in Europe at the Faculty of Pharmacy in Lorraine, France, they found that for a coronavirus, where they tested a 5% solution of chlorhexidine gluconate for its antiviral efficacy against coronavirus, they exposed the coronavirus to chlorhexidine gluconate for 1 hour, and they were able to achieve a 3 log reduction. Well, European Union requires a 4 log reduction in order to be considered an antiviral agent in the EU for coronavirus. So it failed that test. And what's notable is that the exposure time to the virus was 1 hour. Well, there's no way that your patients are going to be rinsing for an hour. And the second thing that's of note is that they used a 5% solution. And in the States, since we use a 0.12% chlorhexidine gluconate oral rinse, That's 42 times weaker or 42 times less concentrated than the chlorhexidine 5% solution that was used in Europe. It has a very poor showing for coronavirus, not effective for coronavirus. For rhinovirus, our 0.12% chlorhexidine gluconate oil rinse has no biocidal activity whatsoever against rhinovirus within 30 seconds. Rhinovirus is a difficult to kill upper respiratory virus, very, very common, and it's a non-envelope virus, which makes it very difficult to kill, but it's also the principal pathogen causing viral pharyngitis, virally induced sore throats. No biocidal activity whatsoever with chlorhexidine gluconate. For Fusobacterium nucleatum, a prominent periodontal bacterium, chlorhexidine gluconate performed very well. It achieved a 4.29 log reduction within 15 seconds. But for strep mutans, a principal cariogenic bacteria, they found that in 15 seconds, it only achieved a 0.19 log reduction, which is so poor that that's the equivalent of starting off with 1 million strep mutans, and after the exposure to chlorhexidine gluconate, still leaving over 810,000 living viable bacteria. Other disadvantages of chlorhexidine gluconate are it's received an FDA safety warning because of the rapidly increasing numbers of allergic reactions. In fact, 4 infants died in a hospital because of anaphylactic shock associated with chlorhexidine gluconate. This was not a dental application, but for a medical application it was directly related to the use of chlorhexidine gluconate. The FDA has also issued many recalls because of microbial contamination of chlorhexidine gluconate. So we mean by that the bacteria were actually living inside this antiseptic rinse. So the bugs were living in chlorhexidine gluconate, and that's the reason that they had to recall product on multiple occasions. Also, if you look at the safety data sheet, which accompanies every bottle of chlorhexidine gluconate required by FDA, that you'll see that it's listed as a potential carcinogen, category 1A, meaning that it was human data that caused that certification or classification to become effective. So every bottle of chlorhexidine gluconate must come with a safety data sheet indicating that it is a potential carcinogen. Also, if you're doing guided tissue regeneration or you're looking for wound healing or gingival repair, then chlorhexidine gluconate is actually working against you because it interferes with wound healing, it interferes with fibroblast proliferation and attachment. And if you've been in a dental office even for a short period of time, then you're certainly aware of that dental calculus is rapidly built up with the use of chlorhexidine gluconate, because chlorhexidine gluconate promotes calculus buildup. Chlorhexidine gluconate also stains teeth and tongue, and also it either has a poor taste or it alters one's taste. And it's only indicated for short-term use for less than 2 weeks, and it's contraindicated for long-term use, partly because it's a potential carcinogen. One of the drawbacks of chlorhexidine gluconate is that it allows microbial resistance to develop, and also it compromises the biocompatibility of titanium surfaces. So it makes implants less biocompatible with its surrounding tissue. And it also inhibits osteoblastic activity. So if you're looking for bony regrowth, then again, it's working against you. And that's why chlorhexidine gluconate is contraindicated for detoxifying dental implants. Hydrogen peroxide works by way of oxidation, and it was recommended by the American Dental Association in their interim COVID guidance as a pre-procedural rinse, as an antiviral pre-procedural rinse. So 1.5% hydrogen peroxide was one of the 2 rinses that was recommended. At the same time, ADA had recommended hydrogen peroxide as a pre-procedural rinse. The Center for Disease Control and Prevention, the CDC, had both on their website and also in their published guidelines for the disinfection and sterilization of healthcare facilities, the notation that for rhinovirus, that 1.5% hydrogen peroxide, the same exact hydrogen peroxide that ADA was recommending, that it requires 18 to 20 minutes to inactivate rhinovirus. So it's an indication that it may not be such a good antiviral agent at all. And in fact, there was a literature survey which was authored by 2 different dental schools and also the virology department of a medical school in October of 2020 that was published in the Journal of Hospital Infection. That literature surveyed actually 976 different scientific articles relating to the efficacy of hydrogen peroxide as an antiviral agent. And what they came away with, the take-home message, is that it doesn't work. And in fact, their words are, there is no scientific evidence supporting hydrogen peroxide mouthwash for the control of SARS-CoV-2 or any other viruses in saliva, and that during the pandemic, it should not be used. And following their advice, the next month, in November of 2020, the public health authorities in Ontario, Canada, along with the Royal College of Dental Surgeons in Ontario, Canada, issued guidance to all dental offices in the province of Ontario. Stop using hydrogen peroxide as a pre-procedural rinse. It does not work. That was followed in the following month, in December of 2020, by a nationwide alert by the Canadian Dental Hygienists Association to all Canadian dental hygienists. Don't use hydrogen peroxide as an antiviral rinse. It does not work. We want to talk a little bit about iodine, and it has a long and storied history. In fact, the first evidence of the use therapeutically of iodine was over 5,600 years ago. This was brought to us by Chinese physicians. This is the first recorded use of iodine as a therapeutic agent. And what they did was they ground up seaweed, sea sponges, and sea urchins into a paste and wrapped it around patients' necks to diminish the size of their goiters, of their enlarged thyroid glands. They had no idea that it was actually iodine in that paste that was the active agent, but they knew empirically by trial and error that it did work. So, in fact, it wasn't even until 1811 that iodine was first discovered as an element by the French researcher Courtois, and subsequent to that, the first therapeutic solutions of iodine were actually alcohol-based solutions or tinctures of iodine. First, a tincture of iodine was introduced in 1908, formed a very, very effective antiseptic rinse, extremely effective, but not very patient-friendly. It's still available today. Again, extremely effective, but because of the alcohol, it burns and stings significantly. So if you had it put on an open wound, you know what I'm talking about. In the early 1920s, the Western governments in particular either mandated or recommended the use of iodized salt. They wanted to add iodine to table salt, and they did, in fact, because of the many, many cases of iodine deficiency diseases. And as an inexpensive public health measure, they felt that if they can make sure that all of our table salt is iodized, then we'll be sure of getting an adequate amount of iodine in our diets, because iodine is also an essential nutrient. Our bodies cannot manufacture iodine, and therefore it's required that we get it from dietary sources. If we don't get enough of it, we suffer from iodine deficiency diseases. In 1955, NASA scientists actually developed Povidone iodine, one of the iodophores, and they did it because they had searched the world for the most effective, broadest spectrum, fastest acting antiseptic agent that they can use safely in outer space. And they wanted it for their space missions. And they could not use tincture of iodine because of the alcohol in the tincture of iodine, alcohol being both flammable and explosive. So it was actually NASA scientists that developed the water-based solutions of iodine that were stable. And because inherently, iodine is not very soluble. It's only sparsely soluble in water and only in trace amounts. But it's readily soluble in alcohol. So that's why it was easier to use the alcoholic solutions of iodine. But NASA scientists developed a povidone iodine by bonding polyvinyl pyrrolidone, a large organic molecule, physically complexing it to iodine molecules. And because the polyvinyl pyrrolidone is so readily soluble in water, it drags the iodine molecules, which in and of themselves would not go into solution, drags them into solution with it. And that was the advent of povidone iodine, betadine, brand name. And since then, from 1955, there has not been a major advance in iodine chemistry in over 65 years, until the advent of molecular iodine oral rinses in 2017. Early Chinese scientists were not the only ones, the only Chinese that had given us guidance with the use of iodine. During the pandemic, the Chinese Ministry of Health had issued a 68-page handbook detailing how they treated COVID patients in China, and also what they did as a precaution for occupational exposure to COVID, and what kind of a remedial action to take. And that was listed on page 13 of their handbook. They distributed that handbook, by the way, to healthcare authorities all over the world. They had it translated into a dozen different languages so that it could be made available to other healthcare authorities. And for each of the indications for occupational exposure, for either skin exposure, for sharp object injury, for exposure of the mucous membrane, like the eyes, or for direct exposure of the respiratory tract, their go-to solution in every one of those cases was povidone iodine. The ADA has also issued guidance for hand hygiene for SARS-CoV-2. And what they found was that for hand hygiene, their recommendation was, hey, use regular soap and use it frequently. And even better than that, use an antimicrobial soap. And better than that, use an alcohol hand rub. Well, at the same time that those indications were recommended by American Dental Association, there was an article that had been published in the Journal of Hospital Infection, which compared the the efficacy, the antiviral efficacy of 9 different hand sanitizers that are used frequently in hospitals. 3 of them were alcohol hand sanitizers. The other 6 were not. The most effective hand sanitizer was Povidone iodine, exactly the same way you get it from your dental supplier or your local pharmacy or your supermarket. Plain old 10% Povidone iodine, 67 times more effective than 99.5% ethanol, almost pure ethanol, which you wouldn't want to use as a hand sanitizer anyway, because it would rapidly dry out your hands. Okay. And it stands to reason that Povidone iodine would be so effective compared to all the alcohols and to the other non-alcoholic hand sanitizers, because it's used as a standard of care in infection control around the world. Surgeons and nurses use it to scrub with, and it's earned its weight, in fact, to be considered a gold standard. So extremely effective hand sanitizer. And in fact, in this testing, they tested against feline calicivirus, which is a surrogate for something you might know as the cruise ship virus or norovirus. Norovirus is responsible for 22.5 million cases of foodborne illnesses every year in the United States. There's a total of 48 million cases each year. So almost half of them come from norovirus. It's the most important foodborne pathogen that we have. Okay. And it was rapidly wiped out by Povidone iodine, not so much by any of the other hand sanitizers. Okay, let's look at Povidone iodine and compare it to chlorhexidine gluconate. For what? For its efficacy against periodontal bacteria. In this study, they took a cocktail of 6 different periodontal bacteria and they exposed it to chlorhexidine gluconate. They exposed it for 60 seconds and they found that at the end of the 60 seconds, there were still over 1,000 viable colonies remaining, over 1,000. And when they exposed the same 6 periodontal bacteria to Povidone iodine, they found that in 1/4 the time, in 15 seconds, it had completely destroyed every bacterial colony. The Povidone iodine showed to be more effective than chlorhexidine gluconate against periodontal bacteria. Povidone iodine is also very effective as an anti-caries agent. And in this study for infants at high risk for childhood caries, early childhood caries, they did a study with 83 infants between the ages of 12 and 19 months. The study was 1 year in duration. Each infant needed to have had at least 4 erupted primary incisors. And also they needed to be caries free at the initiation of the study. They needed also to be on a nursing bottle containing a cariogenic liquid every night, sugary liquid. And just to seal the deal, they also needed to have every one of those infants had 2 successive positive strep mutans cultures from their dental plaque. So their dental plaque was rich in strep mutans, principal cariogenic organism. So in the treatment group, they applied topically to the erupted dentition. Povidone iodine was applied to those erupted teeth in the dental office once every 2 months over a period of 1 year. So 6 applications over the course of a year. In the control group, they used a placebo solution using the same protocol, once every 2 months over the course of a year, topical application. And what they found at the end of 1 year was that for the control group, the ones who did not have povidone iodine applied to their teeth, that a little more than half of those infants were caries free at the end of the 12 months. 54% were caries free at the end of 12 months. But in the treatment group, who did have the povidone iodine, 91% were caries free. For those of you who use minocycline microspheres, there was a couple of studies done in the Journal of Periodontal Research and also in the Journal of the American Dental Association, which actually showed that subgingival application of povidone iodine was actually slightly more effective in clinical attachment gain than was the deposition of minocycline microspheres. We're interested in the not just in planktonic bacteria, but also bacteria which are embedded in biofilm. And they found in a study at Tokyo Dental College Department of Periodontology that a single 30-second application of povidone iodine was effective in suppressing both Porphyromonas gingivalis and Fusobacterium nucleatum in the periodontal pocket in periodontal plaque. So not only does it kill periodontal bacteria, but povidone iodine can penetrate biofilm in order to be able to eradicate periodontal bacteria. There were two literature surveys of note which looked at bacterial resistance related to either iodine or to chlorhexidine gluconate. And basically what they found was there is no published evidence to show that iodine causes bacterial resistance, but there's a ton of evidence that shows that chlorhexidine gluconate causes microbial resistance. And this is documented in many citations in the literature. Chlorhexidine gluconate induces or allows microbial resistance to develop, and iodine does not. And in fact, when we talk about resistance, this is something which is of increasing concern. At Temple University Dental School, Professor Thomas Rams found that in a 20-year period ending in 2020, that for patients who had severe periodontal disease, that in 20 years, that there were more than 15 times as many patients who became resistant to clindamycin than there were 20 years prior, and more than 28 times as many patients were resistant to amoxicillin than there was 20 years prior. So this is an increasing problem, and we should be using antibiotics very, very judiciously and only when it's absolutely necessary. If the situation could be done with something that does not cause, can be countered with something which is, let's say, a local application of an antiseptic agent which does not allow for microbial resistance to develop, we're far better off than just indiscriminately prescribing antibiotics. We're interested not only in the immediate effect of our antiseptic agents, but also in the ongoing substantivity or residual effect. And chlorhexidine gluconate has an excellent reputation for its substantivity. And in this study, they found that chlorhexidine gluconate allows for a decrease of the subgingival microflora for as long as 7 days, but a single subgingival application of povidone iodine allowed for an effect lasting 31 days, more than 4 times longer than did chlorhexidine gluconate. Professor Jorgen Slotz, previous chairman of the Department of Periodontology at USC Dental School, he's one of the preeminent periodontists of our time. He's also an advisor to the Food and Drug Administration and advisor to the World Health Organization. For decades, he's been studying the use of different antiseptic agents for their efficacy in periodontal care. And he's found that povidone iodine is a first choice antiseptic in the management of periodontal disease. And it's because of its excellent antibacterial and antiviral properties, and that it's been safely used in periotherapy for decades. And it's also well accepted by most dental professionals and patients. Professor Slotz cited dozens and dozens of clinical studies in arriving at his conclusions, and I've just highlighted a few of them. One that I've highlighted here has to do with the reduction in periodontal pocket depth, and here they compared, on the one hand, using an ultrasonic scaler, using povidone iodine as the irrigant or coolant in that ultrasonic scaler, compared to, on the other hand, flap surgery. And the result was that for pockets up to 7 millimeters in depth, there was no difference. Ultrasonic scaling with povidone iodine was as effective as was flap surgery itself. Okay, so there was another study that was done on early childhood caries, this one for a 6-month duration rather than 12 months duration. But the protocol was the same. Every 2 months, it was a topical application to the erupted dentition. This is for infants from 12 months to 19 months of age. And in this study, they found that after the 6 months, that was, by the way, compared to a placebo control, and they found in the control group, after 6 months, fully 1/3 of those infants had developed caries. And in the treatment group, the ones that had the povidone iodine applied, none of them developed caries. We also want to take a look at periodontal bacteremias. And in this particular study, what they did was they performed a traumatic procedure. In most cases, it was an extraction, and in some cases, it was an injection, an intraligamentary injection. But before doing either one of those, they irrigated subgingivally with either povidone iodine or chlorhexidine gluconate or sterile water, right? And then they measured the level of bacteria in the patient's bloodstream following that procedure. And they found that the lowest levels of bacteremia came from the use of the povidone iodine. And they also found there was no difference between using sterile water as a subgingival irrigant or chlorhexidine gluconate. And when we talk about periodontal bacteremias, we're certainly familiar with the systemic consequences of periodontal bacteremias. They're associated with stroke, diabetes, rheumatoid arthritis, respiratory diseases, Alzheimer's disease, certain types of cancers, certainly pregnancy complications, and also cardiovascular disease. In fact, the link between cardiovascular disease and periodontal bacteremias is so strong, it's no longer considered that periodontal bacteremias are associated with cardiovascular disease. It is now considered by the medical profession that cardiovascular disease, a direct cause of cardiovascular disease, is periodontal bacteremias. And there are 4 pathways that are cited in drawing that conclusion. One is that with generalized aggressive periodontitis, in those patients, on average, the level of circulating low-density lipoproteins in their bloodstream is twice as high as it is for patients who do not have aggressive periodontitis. And for patients who have chronic periodontal infections, that the vascular endothelium, the inner lining of the blood vessels, of the cardiac vessels, becomes more permeable, becomes more porous. And thirdly, that the lipoproteins themselves, the circulating lipoproteins in the bloodstream, become stickier and bind more readily to the endothelium of the cardiac vessels. So in fact, if you were to examine the plaque, cardiac plaque, you would see the same bad actors, the same periodontal pathogens we see in the mouth, you'll see embedded in the cardiac plaque. And Waterpik has provided some of their own studies. In one study, they found that rinsing alone can allow that rinse to get to 21% of the depth of a 6-millimeter pocket. Yet, with their using their subgingival tip, the what they call the pickpocket tip, and in the use with a water floss or oral irrigating device, that can deliver irrigant to a depth of 90% of the depth of a 6-millimeter pocket. So since that's where we're looking to get anyway, because the base of the pocket is where you have these smoldering, festering periodontal infections, then the deeper we can get into the pocket depth, the better off we are. And even more so, even more effective, is with the use of an antiseptic agent in the liquid of the Waterpik and the irrigant itself. So an antiseptic or medicated solution it would be terrific to be delivered via an oral irrigating device. So Povidone iodine is wonderful. It's got so many things going for it, but it also is not perfect. So Povidone iodine stains. It has an off taste, and it's unstable when it's diluted. So this is important, and we'll talk about that in just a moment. But it's also not as effective as we would like it to be. And in fact, just like with chlorhexidine gluconate, the Food and Drug Administration has issued recalls for Povidone iodine. Why? For the same reason, for microbial contamination, for bacteria living in Povidone iodine, right? And in fact, to show you that this is not just a casual observation, there was recently at the Columbia Presbyterian Hospital in New York, at their Department of Anesthesiology, they noticed that there was a real large uptick in the cases of spinal meningitis that were occurring at the hospital, and they could not determine what was causing it. There was a rash of outbreak of spinal meningitis. So finally, as part of their investigation, they tracked, they took every single open multi-use bottle of Povidone iodine in the hospital, brought it to the pathology laboratory, examined it for bacterial contamination, and they found that fully 10% of those bottles had bacteria living inside them. And in fact, that was what was triggering this outbreak of spinal meningitis. They were using it just prior to spinal anesthesia by painting the back of the patient with a pre-injection skin prep of Povidone iodine that had been contaminated with bacteria. So rather than knocking down the level of bacteria on the patient's back, they were actually introducing bacteria onto the patient's back, which was being carried by the needle track into the spinal fluid. We mentioned about the instability of Povidone iodine. There was a paper that was published called Chemical Considerations Related to the Dilution of Commercial 10% Povidone Iodine for Use in the COVID-19 Pandemic. The author was Professor Colin Nuckolls, who was a professor of chemistry at Columbia University in New York. And what he pointed out in his article was you can't dilute Povidone iodine and expect it to be stable for any length of time, because povidone iodine, 0.2% povidone iodine, was the other antiviral rinse recommended by ADA as an antiviral pre-procedural rinse in their interim guidance for COVID. So 0.2% povidone iodine is a 50-fold dilution, 50-fold dilution of 10% povidone iodine. And if you diluted it and gave it to patients, if you stored it, if you diluted it, let's say in the morning and stored it that way all day and was using it for patients all day, then within minutes it would start to lose its effectiveness. Because when you dilute povidone iodine, you change the pH, and when you change the pH, it rapidly loses its effectiveness and it becomes unstable. There was a very important landmark study that was published in the prestigious scientific journal Nature in November of 2021. And what they were looking to do was to compare antiseptic mouth rinses for their efficacy in reducing SARS-CoV-2 in COVID patients. So this was a hospital study. It was a multi-center study. It was randomized, double-blind, placebo-controlled. There were 84 COVID patients in the study, and the rinses that were evaluated were acetylpyridinium chloride rinse, a chlorhexidine gluconate rinse, a povidone iodine rinse, and a hydrogen peroxide rinse. And they also used sterile water as a negative control. So they first checked these COVID patients for the level of COVID or SARS-CoV-2 in their saliva, and they considered that baseline. Then they had them rinse with one of those agents, and then they measured the level of SARS-CoV-2 in the saliva 30 minutes later, 60 minutes later, and also at 120 minutes later. And what they found was that for the povidone iodine, for the hydrogen peroxide, for the acetylpyridinium chloride, for the chlorhexidine gluconate, none of them were any more effective than was sterile water. And in fact, none of them were able to reduce the viral load by at least 90% in at least half those patients. And their take-home message was this: our data show that salivary viral load in COVID-19 patients was not reduced by any of the tested mouthwashes. Well, if we know what doesn't work, let's look at something that might work. So if you look at the diagram on the left, that schematic on the left with all the red circles, you'll see that's representative of 10% povidone iodine. Now, we call it povidone iodine as if it's one thing. It is not one thing. Povidone iodine is a dynamic equilibrium of several different species of iodine. It's iodide, iodate, triiodide, hypoiodous acid, and molecular iodine. Of those species of iodine, in aggregate, all those species put together in that povidone iodine aggregate to about 31,600 parts per million of total iodine. Yet, the species molecular iodine, I2, is only present in povidone iodine at 1 to 2 to 3 parts per million. 1 to 2 to 3 parts per million. The rest of the iodine in povidone iodine are the other species of iodine. Well, here's the sad part. The sad part is that none of the other iodine species kill germs. The only species of iodine that kills germs is just the 1, 2, or 3 parts per million of molecular iodine in povidone iodine. Wow. And that's why there's only one blue circle in that diagram on the left, because that's representative of the scarce molecular iodine in that povidone iodine, the red circles being all the other iodine atoms. Well, so what's the big deal? So if it's molecular iodine that's killing the germs, why don't we just add more molecular iodine to the povidone iodine, and we'll have more effective solutions. And at the same time, why don't we get rid of some of the other species of iodine in there, because they contribute to staining and toxicity, but they don't kill germs. Well, researchers have been trying to do that for decades and have been unable to do it. Why? Because molecular iodine is unstable. It doesn't hang out by itself. You can't just add more molecular iodine to a povidone iodine solution and expect it to stay as molecular iodine. Molecular iodine will morph into other species of iodine. So they change forms. So that's been a goal of researchers for decades. It wasn't until 2017 when there was an important breakthrough where stable, high-level molecular iodine solutions became available. So that rather than 1, 2, or 3 parts per million of molecular iodine, these solutions have up to 300 parts per million of molecular iodine, and they're stabilized that way. And the other species of iodine, the bad actors, they are suppressed or they're not even present at all. So that at most, there's just a few hundred parts per million of the other species, not tens of thousands of parts per million. And if you look at the 2 vials, you'll see the one on the right is representative of povidone iodine, the typical povidone iodine you know and use. And the one on the left is molecular iodine solution. The one on the left, if you saw it in real life, it looks just like water, looks like tap water. It's that clear, that transparent at 2 to 3 parts per million. So both of these vials contain the same level of active biocidal agent, yet one is deeply staining and the other one looks exactly like water. Now, when you get into higher levels of molecular iodine, like 100 parts per million, then the color takes on a very pale champagne color, but it's non-staining. Okay, so let's take a look here. And this table is a table all about povidone iodine. That's all this table is about, povidone iodine. Every row in that table is representative of a different povidone iodine solution. The only difference between the rows is that each one of those povidone iodine solutions have slightly different levels of molecular iodine. When I say slightly different, I mean just 1 or 2 parts per million different. So when you start off on the top row, and in this study, they found that it contains 0.17 parts per million of I2 or povidone, or 0.17 parts per million. I2 is molecular iodine in that 10% povidone iodine. Well, that 10% povidone iodine on the top row, that's the same way you get it from your dental supplier. It was almost ineffective against polio virus. After 15 minutes, it had only a 0.6 log reduction. And for adenovirus, after 1 minute, also only a 0.6 log reduction. So that's almost half the viruses were left alive in both cases. Yet each row that you go down, when a little bit, 1 or 2 parts per million is added of molecular iodine to the povidone iodine solution, the difference in biocidal efficacy is dramatic. So that in the bottom row, with only 4.88 parts per million of molecular iodine, you get complete inactivation of poliovirus. You get complete inactivation of adenovirus, right? Whereas you only got slight activity when it was at its standard 0.17 parts per million molecular iodine. So it's the molecular iodine that's responsible for the biocidal efficacy. When you increase the amount of molecular iodine, you increase its biocidal efficacy, and that happens in a dose-dependent fashion. Molecular iodine is also very effective as a pre-procedural rinse. Nowadays, the molecular iodine solutions, oral rinses, are formulated at 100 parts per million. In this testing, the testing was done with a molecular iodine solution at 25 parts per million, 1/4 the strength as the current molecular iodine oral rinses. Yet, it completely wiped out rhinovirus, something that chlorhexidine gluconate couldn't even touch. There was no biocidal activity at all with chlorhexidine gluconate. For well-known branded rinses that you're familiar with, the results were horrible against rhinovirus. For one of the rinses that contains essential oils and 21.6% alcohol, that you know what that rinse is, it was completely ineffective. For another well-known rinse that contains cetylpyridinium chloride and 15% alcohol, it was 750 times less effective than the molecular iodine rinse. And for cetylpyridinium chloride again alone, as we say in the Bronx, forget about it. Completely ineffective. Okay, let's compare the efficacy of Povidone iodine to molecular iodine. In the case of Staph aureus, Povidone iodine can completely inactivate Staph aureus in 5 minutes. For molecular iodine, it does the same thing, complete inactivation, in 1/10 the time. For poliovirus, Povidone iodine requires 15 minutes to achieve a 0.6 log reduction. For molecular iodine, it's completely wiped out in 90 seconds. When we compare molecular iodine to chlorhexidine gluconate, well, we already discussed, if you look at the top row, we already discussed that chlorhexidine gluconate wasn't able to pass the antiviral standards in Europe for an antiviral rinse against coronavirus. After 1 hour of exposure, a 5% solution achieved a 3 log reduction. Yet a molecular iodine solution at 25 parts per million, 30 seconds, complete inactivation. For rhinovirus, where chlorhexidine gluconate had no biocidal activity at all after 30 seconds, molecular iodine blew it away in 30 seconds. And for Fusobacterium nucleatum, a periodontal bacteria where chlorhexidine gluconate did very well, 4.29 log reduction in 15 seconds. Yet, the molecular iodine was 100 times more effective than the chlorhexidine gluconate for those periodontal bacteria. And for strep mutans, chlorhexidine gluconate achieved a 0.19 log reduction in 15 seconds. How bad is that? Well, if you started off with 1 million strep mutans, after that exposure for 15 seconds and a 0.19 log reduction, you're leaving over 810,000 living bacteria. Yet the molecular iodine completely wiped it out in the same 15 seconds. There was an important study that was done last year, which compared a number of different antiseptic rinses for their efficacy against periodontal bacteria, in this case, Fusobacterium nucleatum and Prevotella intermedia, 2 important periodontal bacteria. But this testing for all of those rinses was done in the presence of fresh human whole saliva. Why? Because human saliva, the salivary proteins, inactivate and neutralize most antiseptic rinses. So you're not getting realistic information if it's not tested in the presence of saliva. So it's not duplicative of what would occur in the mouth. So all this testing was done in the presence of saliva for each and every one of these antiseptic agents. So they tested at exposure times of 30 seconds. And what they found was that for the molecular iodine solution, they got complete inactivation of both of those bacteria within 30 seconds. None of the other rinses, not the chlorhexidine gluconate, not the cetylpyridinium chloride, not the chlorine dioxide, not the povidone iodine, not the hydrogen peroxide, and not the stabilized chlorine dioxide. None of them was able to completely inactivate those same two periodontal bacteria in 30 seconds. And in fact, the next most effective rinse after the molecular iodine was a chlorhexidine gluconate rinse. And for Fusobacterium, it was 28 times less effective than was molecular iodine. And for Prevotella, it was 730 times less effective. And the other rinses, they went downhill from there. They got worse and worse and worse, or less and less effective, until finally, in the case of stabilized chlorine dioxide, there was no biocidal activity at all for Prevotella, right? So this testing was duplicated again for the molecular iodine against both Porphyromonas gingivalis and Tannarella forsythia at 30 seconds exposure in the presence of fresh human whole saliva, and the results were the same. Complete inactivation, 30 seconds. Now, we talked a little bit about the importance of testing in the presence of human saliva because it inactivates many antiseptic rinses. So this was some testing that was done by the American Society of Microbiology. And what it shows is that 80% ethanol can completely inactivate influenza A virus in 30 seconds. Yet, when you introduce some mucus into that solution, it takes 4 times longer to inactivate it. That same 80% ethanol solution takes 4 times longer because of the presence of the mucus. And that's the same with saliva. So it seriously impedes most antiseptic rinses. Not that 80% alcohol is an antiseptic rinse. Okay, so there was important testing that was done at Utah State University. They have an Institute for Antiviral Research. And what they were looking to do was to corroborate the ADA's recommendation for pre-procedural rinses with hydrogen peroxide or povidone iodine. So they tested 4 different rinses for their efficacy against SARS-CoV-2. They tested at 30 seconds exposure and also at 60 seconds exposure. They tested the hydrogen peroxide. They tested the povidone iodine. They also tested chlorhexidine gluconate, not because it was so good, but because it's so frequently used. And they also tested a 100 part per million molecular iodine solution. The only solution to be completely effective was the molecular iodine solution. It was fully effective at 30 seconds. The other rinses were not fully effective, not at 30 seconds and also not at 60 seconds. All right. So that study was written up and published in the Journal of the International Journal of Experimental Dental Science. And also, so if you like to read the details of the study or the methodology, it's there. Those of you who are familiar with Clinicians Report is an independent dental clinical research organization. It's a nonprofit. It's been around about 40 years. It's very, very widely known and accepted in dental offices. They have over 100,000 paid dental office subscribers to their monthly newsletter. And they evaluated several different oral rinses for their efficacy against SARS-CoV-2. And they compared hydrogen peroxide, chlorhexidine gluconate, povidone iodine, even a foaming hydrogen peroxide, and a molecular iodine solution. And what they found was, and by the way, this was all this testing, well, some of this testing was done in the presence of saliva, and they found that the molecular iodine solution was 275 times more effective against SARS-CoV-2 compared to the povidone iodine solution. And they also found that the molecular iodine solution was the only product which was shown to be effective in the presence of human saliva. Okay, and they point out that yes, it's very important to be testing in the presence of saliva because saliva covers, coats, and protects viruses from exposure, and that it neutralizes antiseptics. And that if you don't test in the presence of saliva, that you're not getting realistic information. They recommend actually that instead of rinsing one time, that you rinse twice in 2 immediately successive rinses, so that the first rinse not only would have an antimicrobial effect, but it would help to clear the mouth of saliva, so that the second rinse can come directly in contact with tissue without the interference of saliva. There was a study of 442 COVID patients, and they wanted to see the level of SARS-CoV-2 in their saliva. And what they found was, on average, in those 442 hospitalized COVID patients, that on average, per milliliter of saliva, there was an average of 1 million viruses per milliliter. And in severe cases, that can get up to 100 million viruses per milliliter of saliva. And they also point out that you only require 1 to a few hundred viruses of SARS-CoV-2 in order to initiate an infection. And that it's really important to make sure that you're getting as much virus inactivated as possible, because they've also found that even sub-infectious doses can be aggregated. So multiple sub-infectious doses can be as bad as one infectious dose, right? So you need to get as much of it as you can. And then also we're told by the head of the Department of Virology and Infectious Diseases at Imperial College of London that the severity of a COVID infection depends on the quantity of the virus in the infecting inoculum. So the larger amount of virus that you're starting off the infection with, the more severe the infection is going to be, right? Then this is a representation of the results shown by clinicians' report. And here we see that if you look at the bottom row, you'll see that because chlorhexidine gluconate and hydrogen peroxide achieved the equivalent of 1 log reduction of virus, that is still left over 100,000 living viruses. And that for povidone iodine, because it achieved a 3 log reduction, that left over 1,000 living viruses. Remember, you only need 1 to a few hundred. And that the molecular iodine achieved a 6 log reduction and therefore left over no living viruses. Molecular iodine has been used in dental offices for COVID protection as a pre-procedural rinse, obviously. It's been used in water reservoirs, ultrasonic scalers, high-speed handpieces, 3-way syringes to knock down the viral load and the aerosol. It's been used as a hand spray for both patients and staff. It's been used as a nasal spray and also a nasal barrier cream. It's been used in ultrasonic room humidifiers and aroma diffusers, also to knock down the viral load in the aerosols. And also it's been used for the cleaning of high-touch surfaces. Molecular iodine is also formulated in a gel for dental use, and it's a wonderful adjunct for to be used in full arch periodontal trays. Denmad or PerioProtect make suitable trays. These are flexible trays. They're made of soft EVA material, ethyl vinyl acetate. They also can be readily fabricated in your office as a standard suck-down tray. They're 3 millimeters thick tray material, and and or your laboratory can easily fabricate it. There are a number of periodontists and general dentists who are using this with excellent results for moderate to severe periodontal disease. You only need to wear the tray with the iodine gel for 5 minutes per day. That's all it requires. And one of the reasons that it works so well is because the gel is viscous. So when it's placed over the arch with the tray in place, it's putting hydraulic pressure, forcing that gel down into the periodontal spaces. And because the gel is more viscous, and because it's being held in place by the tray, it resists the weeping of crevicular fluid coming from the periodontal pockets. So you're getting good contact and exposure, and 5 minutes is all that's necessary to get excellent results. So you don't have to wear it overnight, just 5 minutes wear time once every 24 hours. So we talked about molecular iodine's efficacy, but it's particularly unique because it is so safe for humans. And why is it so safe for humans? We already mentioned that it is an essential nutrient. On the one hand, it is so deadly to germs. On the other hand, it's a requirement for our health. And in fact, to show you just how much of a margin of safety is available, there was a non-dental study that was done in the United States not long ago with 1,000 women. It was for the treatment of fibrocystic breast disease. And they had each one of these women swallow a single 6 milligram molecular iodine tablet every single day for 6 months. And that's the equivalent of drinking 6 ounces of a molecular iodine oral rinse every single day for 6 months. These women, because it was an FDA supervised study, these women had blood tests, they had medical exams once a week, all during the study. There were no reported adverse events. So there's a wide margin of safety because you're not ingesting 6 ounces of molecular iodine oral rinse every single day. In fact, you're not ingesting anything other than what absorption there might be through the mucosa. But very, very, very safe. And remember, it's an essential nutrient. By the way, the reason that they were doing this study, this is just an interesting sideline, that they found that in Japan, the Japanese women living in Japan had almost no incidence of fibrocystic breast disease. But when those same women moved to either Europe, Western Europe, or to the United States and adopted Western diets, that they started to develop fibrocystic breast disease at the same rates as their Western counterparts. So they theorized that this is diet related because in Japan, iodine is present in Japanese diets in general at twice the level it is in the United States, and in certain areas of Japan, like Hokkaido, Japan, it's present at 50 times as much as it is in the United States. And oh, by the way, the Japanese are healthier than our Americans. They live 5 years longer, they have less heart disease, and other health parameters show them to be healthier as well. So, and these are people that every single day ingest a lot more iodine than we do. Very interesting, this molecular iodine. Sensitivity. You may have heard, or you will hear, that about people being concerned about iodine allergy or sensitivity, and particularly shellfish allergy. It's been considered for some time that if you are allergic to shellfish, you're allergic to iodine. That's subsequently been disproven in the medical literature over and over again. It's not iodine in shellfish that causes sensitivity. It's a muscle protein in shellfish called tropomyosin. And for radio contrast media or diagnostic imaging media, where there's been a number of severe and also frequent sensitivity reactions, these reactions are not attributed to the iodide in radio contrast media, but it's attributed to ionic excipients, because when you swap out the excipients and you substitute the ionic excipients for non-ionic excipients, leaving the iodide alone, that the frequency and the intensity of these reactions falls off dramatically. Beyond all of that, there's no iodide in molecular iodine oral care products. And for thyroid toxicity, there's a selective uptake of iodide by the thyroid gland because it's iodide is a precursor to the synthesis of thyroid hormones. It's necessary for thyroid hormones, but the thyroid gland does not selectively uptake molecular iodine. There's no more molecular iodine in the thyroid gland than there is in any other tissue in the body. So that's not a concern for patients who have a thyroid problem. So some people are going to be concerned that they have an iodine sensitivity. And if you talk to any allergist, they'll tell you that it's impossible. It's impossible to have a true iodine allergy because you can't be allergic to something that your body requires. And every body requires iodine. So now it's true that people can have different levels of sensitivity to iodine. And it's true that there have been a number of sensitivity reactions to povidone iodine. But there's so many different components to the povidone iodine, which are not even iodine. And it's also much more concentrated than any of the molecular iodine oral care products. So if someone's had some sensitivity to povidone iodine, it does not mean that they're going to be sensitive to molecular iodine. And in fact, I would do what many allergists would recommend, that if there's a concern, just have the patient have a bare upturned forearm and just put a couple of drops of molecular iodine oral rinse on their bare upturned forearm. And if there's no reddening, if there's no other erythema or swelling within a few minutes, it's a non-event and non-issue. We should be concerned not only about the mouth, even though we're practitioners of the mouth, because the nasal cavity is a greater reservoir for SARS-CoV-2 than is even the mouth. And we've learned from the journal Cell that the nasal surfaces are the dominant initial site for SARS-CoV-2, and that from the ear, nose, and throat journal, that the highest viral loads were within the nasopharynx. From the New England Journal of Medicine, that higher viral loads were detected in the nose compared to the throat. And from the Journal of the American Medical Association, that SARS-CoV-2 is primarily transmitted through contaminated nasopharyngeal secretions. There was an NIH-funded study that was conducted at the University of North Carolina Medical School, where they found that SARS-CoV-2 virus can be detected in aerosol particles which are exhaled from the nose during normal tidal breathing. So the significance of that is that if your patient is sitting in your chair completely at rest, not sneezing, not coughing, not breathing heavily, they can be exhaling virus, shedding virus as an aerosol from the nose. Also, there was a joint study by Harvard Medical School and also Johns Hopkins Medical Center that showed that vaccinated patients, boosted patients, even while asymptomatic, can still become infected and transmit live virus from the upper airway. They can be carriers, even if they don't have an infection themselves. They can be carriers and transmit live virus. And it's not just virus that we're concerned about from the nose. A study at the University of California School of Medicine showed that for the typical adult in the United States, that 20% of those adults have staph aureus, have MRSA, methicillin-resistant staph aureus, colonized in their nasal passages. And that can get up to 60% of the adult population in the United States. They also found that there was a 3-time better response to molecular iodine intranasal application than there was to Povidone iodine intranasal application. And if this looks like some of your patients, I'm a little bit concerned about you. But actually, these are canine studies. And here, these studies were done under the auspices of the VOHC, which is the Veterinary Oral Health Council, which supervises veterinary dentists. And what they found was that in 2 successive studies, in 25 dogs in each arm of each study, they were looking for plaque reduction. And since these dogs were in kennels, they were able to control the dogs' diets. And for the treated dogs, what they did was they took a small nutritional amount of molecular iodine, put a few drops into the dog's drinking water. This is a nutritional amount because molecular iodine or iodine is just as required by dogs and cats because they're mammals just as humans are. So it's a requirement for their nutrition as well. Only in this case, the level of iodine was reduced to just nutritional levels within the nutritional guidelines. So consider this as a nutritional supplement for these animals. Yet they found that for those dogs that were treated, there was a 44% plaque reduction compared to the dogs that were not treated, that just had their regular drinking water. What makes this interesting is that there was another study that was published in the Journal of Veterinary Dentistry that showed the effects of toothbrushing under veterinary supervision. And they found that even with daily toothbrushing, every single day for a month, brushing of the dog's teeth, they were only able to achieve a 37% plaque reduction, which was significantly less than just adding a couple of drops of molecular iodine to their drinking water in reducing dental plaque. And this is a big deal for dogs because unlike humans, they can't take care of their teeth. They have to rely on others to get their teeth taken care of. And that's why by age 2, 85% of dogs have periodontal disease. So it's even a bigger problem for animals than it is for dogs than it is for humans. So more effective by just putting a few drops in a pet's drinking water, and you don't have to struggle with the dog every single day, trying to get him to hold his head still while you're brushing its teeth. Okay, we talked about the systemic consequences of periodontal disease, and this is just an example of it. So for this journal article, it was published in the Journal of Clinical Periodontology, they found that with periodontal disease, that it increases the severity of COVID, and that it does it so much that that if you have periodontal disease, you are 3 times more likely to be admitted to intensive care if you have COVID. If you have periodontal disease and COVID, you're 4.6 times more likely to need a ventilator, and you're 8.8 times more likely to die. Okay, so again, systemic consequences to periodontal disease. So let's get it at its source. There was a study that was done, and that was the data was taken from the National Practitioners Data Bank, and they took a cohort of over 16,000 malpractice lawsuits against dentists and dental hygienists, and they were looking for the top reasons why those suits occurred. And one of the top 5 reasons was either supervised neglect of the teeth or failure to treat. So 8 years later, we can't rely on the patient's recall that you referred them for specialist care, or that you made specific treatment recommendations that were or were not, that may have been refused at the time, or you made specific home care recommendations that they may or may not have followed. So unless you have contemporaneous documentation that you either referred the patient, or you made specific treatment recommendations, or you made specific home care recommendations, then you're responsible. You're responsible if it is not documented at the time that those recommendations were made. Okay, so we're going to try and answer as many questions as we can. If we don't get to them all, please feel free to reach out to me. You're going to be given, here's my email address, and we'll try and get any question answered for you. So well, let's get to the questions. So was the diluted povidone iodine effective longer when refrigerated? That was not part of that study. My inclination is that it would be effective longer if it was refrigerated, but it's not something that I would even begin to take a chance with. Is molecular iodine being used in ultrasonic scales? Is it being used full strength since it is unstable when diluted? Does it hurt the instrument? Okay, so, all right, so very good question. So when I said that molecular iodine is inherently unstable, then I meant that was before the advent of patented molecular iodine solutions, which solved the problem of their instability. So it's not a concern. They get 2-year shelf life with the current molecular iodine oral care product. So that's not a concern. There is no longer a question of instability when you're using high-level molecular iodine solutions. The other part of that question, is it being used full strength? So depending on the application, if it's being used in an ultrasonic scaler, I would recommend the use of there's a molecular iodine concentrated irrigant, and I would use 1 part concentrated irrigant to 3 parts water in the reservoir bottle of the ultrasonic scaler. And does it hurt the instrument? No, it does not hurt the instrument. It's been used for years for that purpose. In fact, there's a manufacturer of dental units that immersed the dental units in molecular iodine solution, concentrated molecular iodine solution for 2 weeks in a far greater concentration than we would recommend its use. And there was no degradation of any parts. The ports worked perfectly. There was no problem. So no, that's not a problem. Would like to know if it's effective for pemphigus. We've had reports, anecdotal reports, that it has been used for pemphigus and that it has been effective. Where can we purchase? After this question period, or by the way, after these questions, those who would like to leave the webinar, you'll be able to get your credits, no problem. Those who want to stay to learn about molecular iodine products and any specials there might be with these molecular iodine products, where to get them, and have each product explained to you, then Angelique Adderley from ioTech International will be doing just that. So there's really good information there, and she'll be answering that question as well. Where to buy the molecular iodine? You'll get that answered by Angelique Adderley if you're staying off of the product portion. Does it lose its efficacy when exposed to light? Under normal conditions, absolutely not. The only instance that I'm aware of where where there was a loss of efficacy due to light, was not ambient light, not even sunlight. But when it was put out on a windowsill and sat in direct sunlight in a clear container for a few days, did there seem to be any kind of loss of efficacy at all. But I can tell you that it's in clear bottles, in ambient light. It's good for years. Can you tell us how often to use molecular iodine rinse in order for it to be effective to reduce decay and perio? I would recommend the use of molecular iodine twice a day, morning and night. I myself use it in the oral irrigating device every night. And so I have 300 milliliters of a molecular iodine solution running through my mouth every single night. And that's why I'm so ornery. All right, so so would you suggest for scaling, root planing, and perio surgery to have the patient rinse with molecular iodine 30 seconds twice back to back before treatment? That would be the most effective way. Actually, depending on what you're trying to accomplish, that will knock down. That will be the most antimicrobial of either a single 60-second rinse or a 30-second rinse. Two back-to-back 30-second rinses will be the most effective antimicrobial protocol because you're clearing the mouth of saliva. Although I will also say that it's not such a big deal, if any, for the molecular iodine because the molecular iodine was so effective even in the presence of saliva. So so it isn't really necessary, but it's more ideal. Okay. Okay. Thank you so much for the information. Okay. Good. Okay. So with that, I'm going to again, those who want to leave, you're welcome to and get your credits. And for those who would like to stay and learn more, you're going to get some really good information. So I'm going to introduce Angelique Adderley. She's our Director of Consumer Relations, and she knows as much or more about these products as I do. So Angelique, have at it. All right. Thank you very much.
I also want to remind everybody at the top of the screen is the link to ioTech International. And Angelique now is going to be talking about products. Again, if you want to take your quiz, log off. We hope you'll stay on because there will be promotional opportunities as well as free samples. So if you want to order those, please stay on. Otherwise, we are going to thank you for being here and thank Angelique for getting started.
Thank you, Dr. Rowling, and thank you, everybody, for staying on for this portion of our webinar. I'm here to give you some information about molecular iodine products that are available from ioTech International. I can tell you the availability of these products, how to get it, and also how to get free samples for your office, and also patient brochures. So the first thing I want to let you know is if you tap that banner at the top of the screen, that will take you to a form for to request free samples as well as literature for your office, and we also have brochures available as well. So I'm going to get started with our current ioTech dental products. So these are the current products that are available from ioTech International. The first product that you see at the top left of the screen is iRinse Ultra. iRinse Ultra is our first OTC drug product that is available. iRinse Ultra is indicated for anti-plaque and anti-gingivitis use. This is available in a soft mint flavor. And iRinse Ultra comes in a 1 liter size bottle or a 16-ounce size bottle. Now, the 1 liter bottles come 12 bottles per case, and the 16-ounce bottles come 24 bottles per case. iRinse Ultra is a ready-to-use formulation, so there's no dilution necessary, and this is good for daily ongoing use. iRinse Ready to Use is a formulation that some of you may be familiar with. This is one of our very first products that was available. iRinse RTU is available in green apple or soft mint flavor. The soft mint does contain xylitol. These products are both available in 1 liter or 16-ounce sizes, and case quantities are 12 1-liter bottles per case and 24 16-ounce bottles per case. Like iRinse Ultra, these products do not need to be dilutive use. They can be used for pre-procedural rinsing as well as daily at-home rinsing for your patients. They can be used every day, just as any other mouth rinse, recommended twice a day for at-home use, ongoing long-term. Next, we have our ioRinse Concentrated Irrigant. Now, the concentrated irrigant is the product that would be used for at-home use in a water flosser or water pick for your patients. And it can also be used in office in water irrigating devices for scaling and root planing. Now, iRinse Concentrated Irrigant is a stronger formulation of molecular iodine, and this is diluted for use in the water pick. Your patient would add 1 capful, or 30 milliliters of iRinse Concentrated Irrigant to the tank of their water pick, and then fill the rest of the water pick up to 300 milliliters. So that's 30 milliliters of concentrated irrigant to 70 milliliters of regular water. iRinse Concentrated Irrigant is available in green apple flavor, and it comes in a 1 liter size bottle, 12 bottles per case. IOGel Tray Gel is a thicker formulation of the molecular iodine. IOGel is for use at home in a periodontal tray. The patient would add some of the gel into their periodontal tray, place the tray into their mouth for about 5 minutes. They would then remove the tray, spit out the excess. IOGel is available in a 12-ounce bottle, 12 bottles per case, and it's a green apple flavor. So at the bottom left, we have ioCleanse, which is our hand cleanser. This is it's a 1 liter size bottle, and it does come with a spray head that attaches to the bottle. ioCleanse can be sprayed directly onto your hands. It gives you all the benefits of molecular iodine for external use. ioCleanse does not contain alcohol, so therefore it's non-drying to the skin. You simply spray it onto your hands and allow it to dry. This comes in a 1 liter size bottle, 12 bottles per case. Next, we have our 2 nasal products that contain molecular iodine. First, we have ioMist, which is a saline-based nasal spray. This comes in a 1-ounce bottle with 24 bottles per case. ioMist it comes in a mister bottle, so it's something that they would use individually. This is not something that's used across different people. So therefore, it's good for patients to purchase and to use individually. But for in-office use, we have our ioShield nasal cream.
Do they also have a Mrs. bottle? You said they have a Mr. bottle.
ioShield is available in a 2-ounce jar. It comes 9 jars per case. ioShield is a more cost-effective use in office because it can be applied with a disposable applicator. You would take a small amount, swab inside each nostril and pinch the nose, and this gives you a physical barrier with the cream as well as the molecular iodine barrier. So ioShield it just becomes a great solution for in-office use for during procedures. And last, we have our ioVet Oral, which is a pet water additive. So this is our first pet product that is available. And Dr. Moskowitz did discuss this product in his presentation. ioVet Oral comes in a 4-ounce bottle, and it also includes a graduated dispensing syringe. And that is allowing for easy measuring and dispensing into your pet's water dish. ioVet Oral is put into your pet's water dish just 1 time per day, and it gives the benefits of the molecular iodine, and all the information that is available on ioVet Oral was also available in our literature packet if this is something that you're interested in. ioVet Oral is a 4-ounce bottle, and it comes 18 boxes per case. Any of the products that you are interested in learning more about, please fill out that form, ask us any questions there, or we can contact you and discuss anything about any of the products and give you any information that is available. We do also offer virtual office learns. So if you are interested in having your office learn more about our products, you can scan that QR code or go to the website on the screen, or just tap the banner at the top of the screen and you'll get free samples for your office of our Perio rinse, and also free patient brochures are available. These patient brochures, they stress the importance of each patient's daily home dental hygiene and why that all the patients should be using this for daily rinsing for at-home use in between office visits. In 2018, Clinicians Report did an evaluation of our ready-to-use and our concentrated irrigant. In this evaluation, there were 250 patients. 125 of those patients used the concentrate in their water pick. 125 used the ready-to-use formulation. These patients were taken from 50 offices, 5 patients per office. And this gives just an overall rating of the feedback that they received from this evaluation. As a result, in 2019, we were listed in Clinicians Report Buying Guide as the best product for 2019. As a result of the evaluation that was done and the research that was done in 2021, we were listed in their best product as a best product for 2022, and again in 2023 and 2024. These articles are also available if you are interested in them, and I think they're also included in your handout, so you should also have a copy of that 2021 research article. This is a list of just a few of many key opinion leaders that do recommend the ioTech products. These articles are also available if you are interested in any of them. We can provide them to you. You can reach out to us. I'm going to provide our contact information for you, as well as Dr. Moskowitz's email, so that if you have questions, you can just reach out to us and we'll be happy to answer any questions that you may have. Now, I know some offices do stock product and provide them for their patients, and this is just a quick illustration of projected profits per office. We do provide our products at wholesale pricing. So if you order from our professional store, this will give you access to wholesale pricing on case quantities of the product. And this gives you a great margin for earning a profit in your practice through the sale of the products. Now, if you are an office that does not stock product, we also have a brand ambassador program available, which you can also ask us about in that by tapping that link. So if you are interested in the brand ambassador program, you can earn commissions through sale of our products without having to stock them. So we do have different options available. And if you order 10 cases or more, we have additional discounts as well, and an additional 15% off our wholesale pricing. So if you're interested in bulk ordering, please contact us and we can help you with bulk orders as well. Now, and as an economic comparison of oral rinses, even with all of the benefits of the molecular iodine rinses, it still remains one of the most cost-effective rinses that is available for your dental practices. These are standardized to 1 liter size bottles, and these are prices that were taken from professional dental websites. ioTech is the manufacturer of the molecular iodine rinses, and we do have all the products that we discussed available. We are located in Florida, so all of the products, if you are interested in them, they are available through our professional store. We also have a consumer store on our website where your patients can go to order individual bottles. But for case quantities, you do want to go into our professional store on our website. It may ask you to create an account if you have not done so already. And this just gives you access to the wholesale pricing, which are available to professionals only. your patients, if they are interested in ordering, would go into the consumer store. We are available Monday through Friday from 9 a.m. to 5 p.m. Eastern Standard Time. So if you do have any questions or need any help with the website and any ordering, please feel free to reach out to us. And if you do have questions about samples, click that banner at the top of the screen and fill out that quick form. We will be in contact with you about a sample program that we do have available, as well as our brand ambassador program, if this is something that you're interested in for your office. Now, I am going to see if we have any questions about products that I can answer. And I do have Dr. Moskowitz here for any technical questions that we may have as well. And once again, I do want to thank you for staying on for this portion of the webinar. And I'll be happy to answer any questions following this webinar as well. Okay. So, Dr. Moskowitz, I have a question for you.
Yes, ma'am.
So would you suggest for scaling and root planing and perio surgery to have the patient rinse with molecular iodine 30 seconds twice back to back before treatment? I think you did. Okay, got that one. Okay. Do you have to dilute the concentrated irrigant for scaling and root planing irrigation?
That's the second one I answered.
Okay.
Yes.
So we know how, okay.
Yes, using the concentrated irrigant, diluted 1 part concentrated irrigant to 3 parts water.
Okay. The shelf life of the products is 2 years. You do want to keep the lid tightly closed. So you make sure you close the cap so that the iodine does not escape. The product does have an amber color.
Don't let the genie out of the bottle.
Correct. Do not let the genie out of the bottle. You don't want to leave the bottle open so that the iodine can escape. And you can always tell that there is iodine present because it does have an amber color, but it is non-staining. Okay. What is the recommendation for use for pets? So it is 1 milliliter of liquid for every 8 ounces of water. So the dosage does depend on the size of your pet's water dish, and it's just added 1 time per day.
The directions are right on the bottle.
Yes. There are. Okay. Let's see if we have any other questions. I think you did answer these other ones.
I think we have, Angelique. Dr. Moskowitz, talk a little bit about xerostomia and how great this product is for xerostomia and dry mouth.
Yeah, so we haven't done any actual studies for xerostomia, but I can tell you that we've had dozens and dozens and dozens of unsolicited anecdotal reports of use with for oral ulcers, for oral mucositis, for xerostomia, and because and we feel very strongly that it's going to be very effective also for caries control. Because there have already been in vitro studies that shown that it's phenomenally effective against strep mutans, complete inactivation in 15 seconds. So, for all of these instances, we feel it'll be excellent for xerostomia, particularly the ioRinse soft mint, which contains both xylitol and glycerin, along with the iodine, that it's a kind of like a go-to product for xerostomia.
And we want to remind everybody to go to the top of the screen to contact ioTech. Question here about burning mouth syndrome and lichen planus.
Yes, it's been used successfully for lichen planus, and I can't even begin to tell you of all the instances where there's been irritation of the mouth, where there's been idiopathic mouth pain, that it's very, very effective. As it turns out, that even though we know iodine to be a wonderful antiseptic agent, it also has other properties. It has other mechanisms of action, which point to why it would be so effective in these for these other conditions. And one of them is that it modulates the immune system. Another reason is that it also acts as an anti-inflammatory agent. And these have been documented in a number of ways. That's actually the subject of an entire webinar all by itself. But there's very, very strong evidence for why it has effects well beyond that of an antiseptic agent. So one thing you can know for sure is that these products are absolutely safe. So you can experiment with them. You can try them with different situations and know that you're not harming the patient, and in most likely that you're going to be doing the patient a great deal of benefit that they could not get with any other product.
Dr. Moskowitz, what about denture wearers? What about for cleaning dentures? Yes. So it's since iodine is so effective, not only as an antibacterial agent and also an antiviral agent, but also as an antifungal agent. So for fungal conditions, particularly where hygiene is not absolutely the best, can't be the best when you're wearing dentures. So it's excellent as a denture soak. Now, having said that, I want to caution you, if the denture is poorly made, if it's poorly made where there are where it's very porous and it's not dense, it wasn't pressure packed, then you might get some staining, but it has to be like really poorly made. A normal denture, a normal acrylic denture, no problem. Got a question here from Jacqueline. If this is an essential nutrient and there's such great results in dogs with plaque and calculus buildup, why is there not a liquid form for humans in their drinking water?
Actually, there is. In fact, I can tell you that when I was in the Army, they issued iodine tablets to disinfect drinking water when we were out in the field. So if we were out in a pond or a lake, some unknown water supply, that we would add an iodine tablet to our canteen of water to disinfect the water. So yes, it is used in water supply, and it actually is very effective against Giardia and a number of other parasitic agents.
There are actually areas in the U.S. where there's an iodine deficiency, and the local health departments pass it out because it is an essential nutrient.
Yeah.
Right. So, any other questions for Angelique or Dr. Moskowitz? I think we've hit the end of the internet here, Angelique. You both did a fabulous job here. Let's see, there's something here. Okay, we've got a quiz question here. Please log out and you'll be redirected to the quiz, and there will be a reminder email that will be sent in about 10 minutes. Any questions for either Angelique or Dr. Moskowitz? Again, please tap on the banner at the top of the screen. You can bookmark that if you'd like to take the information back to your dental practice tomorrow. Question here, for kids 1 to 2 years, can we apply every 2 months?
Yes, without question. Even kids have a need for iodine.
Yeah, and I will be sending a follow-up as well with our links to Dr. Moskowitz's other webinars, and a follow-up with that link at the top of the screen as well. So if you don't get it tonight, you should expect an email with it tomorrow as well.
Terrific. Well, thank you both for being here and another excellent presentation. And you have so many great remarks here. And kudos from everyone that attended. So with that, we can adjourn everyone and get you all to your quiz. We again want to thank you for being here. Please reach out to ioTech. You can bookmark again the URL by tapping on the banner at the top of the screen. And we appreciate you both being here this evening. Thank you, Angelique. Thank you, Dr. Moskowitz.
Thank you, everybody.
Thank you all. Thank you all for attending.
Have a good night.
Good night.